I am Dr. Biswajit Sahu, medicine specialist in Corporate Clinic, Bhubaneswar. So today we will discuss regarding the link between diabetes and GERD. First of all, we all know that diabetes is a long-term condition where the body does not make enough insulin, a hormone that controls blood sugar level and cannot use it properly. When diabetes is not treated properly, blood sugar can get too high and a condition known as hyperglycemia, leading to serious damage over time, especially the nerve, blood vessel, and some muscles also. So patients with diabetes experience digestive issues like acid reflux, trouble in swallowing, nausea, vomiting, and dyspepsia, and some heartburn, stomach pain. Some other also complaints like diarrhea and constipation, and bloating more often than in general population. So GERD, the full form is gastroesophageal reflux disease, is one of the digestive issues which occurs when stomach acid and bile flow back into the esophagus. So that means food pipes then irritating the protective lining of the esophagus. So this condition can damage the esophagus mucosal layers and lead to long-term inflammation. That is called esophagitis, trouble in swallowing, and that complains. So trouble in swallowing and increase the risk for esophageal cancer. So while GERD is more common in people who are overweight, so it occurs more often in those with the diabetes, regardless of their weight. So let us turn what is the link between the diabetes and GERD. So in people with diabetes, GERD can happen due to many factors, including obesity, nerve damage, and hormone imbalance. Obesity increases pressure in the abdomen, which can lead to hypertension. So what is hypertension? The part of stomach extends through the opening of the diaphragm into the chest. Weakening of the esophagus muscle causes the acid reflux and diabetes related nerve damage also affects the movement of the stomach and the esophagus. The peristaltic movements are also affected. That leads to acid reflux. So high blood sugar can cause gastroparesis, a condition where your stomach has trouble emptying its content. Gastroparesis and GERD are closely related in many ways. When the stomach empties slowly due to gastroparesis, food can stay in the stomach longer time, increasing the chances of reflux, which can lead to GERD. Diabetic autonomic neuropathy is a condition where diabetes damages the nerve and the control important function like your heartbeat, blood pressure, and sweating, digestion, urination, and sexual function. When the nerve in the stomach and intestine are affected, it can lead to delayed stomach emptying. This can cause symptoms like bloating, belching, heartburn, all the symptoms of GERD. So diabetic autonomic condition. Specifically in patients with type 2 diabetes and high blood pressure, also known as hyperglycemia, can lead to so many changes that affect the digestive system. These include increased stomach acid production, higher level of bile acid, and lower bicarbonate level. Additionally, people with type 2 diabetes may experience slower emptying of the stomach and esophagus, more frequent relaxation of the lower esophageal sphincter, a muscle at the bottom of your esophagus, and lower pressure in the lower esophageal sphincter during high blood sugar. That leads to acid reflux. Conditions like hypertension and higher rates of obesity may also play a role in development of GERD in people with type 2 diabetes. Thank you.